It is really my honor to be here today. Peter, thank you so much. It was a pleasure for us to travel in from New York, not a big deal, because this is such an important day. It is personally important to my husband and I for a lot of reasons. It is important to me as a journalist. I think we are at an incredible moment right now in this movement to try to break the stigma around mental illness and mental health in the workplace and way beyond the workplace. It does feel like we're sort of at a watershed, and I'm inspired that you're all here, right? That there are gatherings like this where we can talk openly about these subjects that really matter. I'm honored to kick the day off. We're going to start with a renowned panel of experts, business leaders, healthcare disruptors, as they try to bring best practices for mental health in the workplace. So I'd like to introduce them, and if you could hold your applause until we're all up here, that would be great. So Christopher Swift is the Chairman and Chief Executive Officer of the Hartford. There he is. Kelly Nantel is the Vice President of Communication and Advocacy at the National Safety Council. Dr. Mark Friedlander is the Chief Medical Officer of Behavioral Health at Aetna. And Garen Staglin is co-founder and board chairman of One Mind. Please welcome everyone. How you doing? So we're going to kick things off with kind of a broad conversation to set the stage for today about where we are, like what the status is in terms of the workplace and mental health. Dr. Friedlander, I'd like to start with you. What led us to this critical moment that we're at in the workplace?
It's hard to define just one single
Is that
issue.
On? Can you guys get Dr. Friedlander's microphone?
Okay.
Try again.
Okay. It's hard to enumerate just one.
There you are.
It's not just one thing. I think there are a variety of factors, all of which have contributed to greater awareness, greater access, more evidence base for what we need to do. But in many ways, it boils down to what we as a society value. In my opinion, when we take a look at the behavioral health field, and when I talk about behavioral health, I'm meaning addictions, substance use disorders, as well as mental illness. When we take a look at the whole behavioral health landscape, we've seen tremendous change, we've seen tremendous awareness of it's a medical condition now. We've also seen an increasing recognition that it's not just a medical issue, it's a societal issue. There's increasing awareness of the impact that social determinants have on folks, on their well-being, and it's no longer just a question of sick care, it's a question of what can we do to keep people well, how do we help people figure out a way to emphasize their mental health as well as their physical health. Right. We're very aware of the impact that exercise and physical work has had on folks. There are so many wellness programs on the physical medical side. There's so much engagement by folks in taking care of themselves, being aware of smoking, being aware of appropriate diet, being aware of the impact that exercise has. And we're only starting to have an impact on the behavioral health side for those things. People are starting to engage in wellness activities for their psychological well-being, and I think that that's only going to increase.
Yeah. Christopher, I know I've seen a shift at my own company at NBC Universal, to your point, where there's more emphasis on wellness. There's also, as a parallel track, it was mentioned by Peter that I've done a lot of reporting on substance abuse. Talk about substance abuse and how that fits in with what companies need to be looking at around mental health.
Sure, I'd be happy to. First, it's great to be with you. Happy birthday again.
Thank you.
Welcome to the club.
Not real happy to be in that club.
This is a topic that I'm pretty passionate on from a business side and also for personal reasons. But the Hartford, as a leading workers' compensation and long-term disability provider, I think we have unique insights from data and analytics that really tell a story of a tremendous toll on individuals, families, communities, and society at large. And my message ultimately is this isn't just a public health issue. I mean, it is a business issue dealing with addiction, at least from our perspective. So if we think about the business implications of particularly the opioid crisis that we see, it deals with reduced labor force participation rates. It deals with higher medical costs, absenteeism, more recruiting and turnover, and really loss of productivity. Estimates right now, for 2017 would say it's a $500 billion issue for our U.S. economy. And if you think in the context of a $17 trillion economy, it's 3 to 4%. So it's real and meaningful, problem. So, to me, it's what can we all do, together, to sort of fight it. I would give you just a couple little bit more data points just to make sure the audience is fully grounded, which I know you are. But there were 70,000 deaths from drug abuse in 2017. 30,000 were opioid related. We've done a survey of employers, both large, small, medium size, and we would share the data that says HR representatives feel that their businesses are being impacted by the addiction crisis in a meaningful way, but 30% would say that they're ill prepared and don't really have it a priority to move forward. So I think it's time for all of us, business leaders, communities, healthcare professionals, really to come together and put our resources and put our shoulder into this, and really think in terms of what are really practical solutions going forward.
And I think we're going to hear a lot of agreement up here on this topic. Kelly, you work with the National Safety Council, which people probably think of, I think of it as workplace safety in terms of, not getting hurt on the job physically, but mental health is equally important. What do you find as you survey the landscape?
I think we're seeing the impact of this crisis significantly in workplaces. As Chris said, lost productivity is a piece of it, but even injury and death in the workplace, and particularly companies are reporting having direct impact in the opioid crisis with overdoses in their workplace. So we know it's there, and I think to Chris's point, it's really making the case for business owners to stand up and take notice. And several years ago, we partnered with the organization Shatterproof, along with NORC from the University of Chicago, to create a cost calculator that allows business owners or safety professionals or HR professionals who are recognizing the crisis in their workplace to monetize it. What does it mean to the company in lost productivity and insurance costs, all of those things. And that cost calculator helps to make the safety case for getting engaged on this issue. We know your surveys are terrific, and we did a little bit of a deeper dive just this year. We surveyed 500 HR professionals, safety professionals, and mid and senior level managers because we wanted to see it from all of those perspectives. 75% of them said they know they've been impacted by the opioid crisis. Our cost calculator tells us that number is even greater than 75%. But even that recognition is significant. So we know we've got to give employers resources to help address the crisis.
Garen, it's easy to say we've got a crisis and we need the workplace to respond. Mm-hmm. What's the brass tacks, globally or nationwide? How are companies doing in addressing the issue?
Well, I think everyone in the corporate world knows that this is the right thing to do, but I think they have had problems in getting started, and some of the data that was just presented proving that it's actually good for business. I think we see in the utilization of employee assistance programs, which are the care that people often have available to them in corporations, the utilization rates are less than 10%, 5% of the people who have it, because guess what? They're afraid to go forward because of the potential for discrimination. I'm going to be put at the back of the line relative to promotions or treated as somehow not equal to the rest of my peers. So we've been at this for about the last 3 years to try to replicate what happened in the CEO Roundtable for Cancer, which Bush 41 put in place. Excuse me.
Water.
Yeah, somehow I got a frog in my throat. I think I can get through this. Here we go. All right, good. And that was to create a standard of behavior for corporations so they'd have some guidelines. So we created a charter of 8 principles that allow companies to adhere to a series of long-term commitments. And we make the CEOs of the companies who are engaged with us in this effort sign that charter, because it can't just be a short-term HR program, and B, it's got to be a long-term resource commitment for companies. So we're pleased to tell you now that we have over 2.2 million employees and hundreds of employers who are now signing up to this charter to go forward with this idea that we can make a difference, not in the short term, but in the long term, and celebrate the diversity of everyone in the workplace.
Yeah, and having them sign that piece of paper, I suppose, kind of holds people accountable.
And we don't let them in if they don't sign. I mean, there's a small membership fee, but that's the cost is really the cost of the total commitment of the corporation and allow that to happen.
Dr. Friedlander, in 2008, President George W. Bush signed the Mental Health Parity and Addiction Equality Act into law. I remember I covered the White House then, and this was a big deal, right? This was going to change everything because it was going to put mental health on equal footing as physical health, so that insurance companies would have to cover both. Where are we in terms of that? Are we still, did it help, or are there more changes needed?
There's no doubt that more changes are needed. I can only speak for my corporation, for my employer. We were committed to mental health parity way before 2008, and that work has only accelerated. Benefit design is one of the primary drivers of what's accessible to employed individuals and their families. So the Parity Act goes far, but perhaps not far enough. I think it's the Parity Act as a scaffolding, as a framework, but there also needs to be attitudinal changes, societal changes, greater understanding by members of the public on how to access care, a recognition of what is available to them. Because when I take a look at our internal data, echoing some of the points that have already been made, only 8% of employees access any behavioral health services. And we know from the statistics that probably 20% of folks at any particular point in time actually have features of a behavioral health condition. So I think the Parity Act was a great step forward, but there are a whole lot of complex interacting factors that also need to be considered. For example, on the provider side, if we take a look at medical specialists, the dermatologists, the surgeons, approximately 90% of them, these are American Medical Association data, approximately 90% of them work with insurance companies. They'll accept a patient's
Can you say that number again?
90% of medical specialists. When it comes to psychiatry, it's about 50 or 55%.
Yeah.
If we talk about non-physician behavioral health practitioners, it's even lower. So when people take a look at the statistics and say, parity didn't go far enough, parity is still problematic because so many people have to go out of network to access behavioral health services, it's a little more complicated than that, because it also is a question of participation. And it's not just parity ensures that the psychiatrists are paid exactly what a neurosurgeon would be paid in the same market for the same billing code, but it goes further than that. It's not just the reimbursement, it's the hassle factor, it's the difficulty of working with insurance, but there's also, in my opinion as a physician, an obligation that a physician has to his or her patient to say, I understand that you want to use your insurance to access services that you need. I need to figure out a way to make that possible for you.
Christopher, did you want to weigh in on that? I see you. Look, can I just say, as an employee, and I'll say this publicly, we have mental health issues in my family. We have psychiatry bills. It is really difficult. I live in New York, and I have a great job and a great insurance plan. It's It's not yours. But I bet everybody in this room can relate to the fraction of what is covered, because I live in New York City and nobody takes insurance. I mean, most of the better doctors don't take insurance, and I have to file it myself, and then I have to go to my company to try to get reimbursed, and I get this much of what I've spent out of pocket. I think this is a global problem. What solutions do you have?
You know, I want to address, you know, the practical side of what you talked about, but yeah. I think also from a leadership side, as the doctor said, I mean, I think it's important that leaders of any organization know that their voice is powerful and can create change. And I think as CEOs or leaders, you could really do three things that really help the issue. One, I call it cultural change related to stigma and shame.
Yeah.
I mean, we've used that word already quite a bit this morning, but it's real. Second, I would say, to focus ultimately on education of individuals, education of employees, on what questions to ask, what resources are available, because sometimes they go underutilized. And then third, as a leader, you can provide resources that deal with prevention, treatment, and recovery. And if you take those things away and internalize them in any organization, I think you can develop good strategies. I'll give you two examples, just particularly dealing with shame and stigma, because that then frees up people, I think, to do more regarding education and seeking further information and getting help. We know the silence of shame is deafening as far as producing actions and outcomes. So we've taken on the personal obligation to talk about it. Talk about it with our 19,000 employees, either in town halls, blogging. I've written op-ed articles, about it. I've been on tours speaking about it because I'm pretty passionate about it and I know what's involved. But specifically, I could tell you culturally, we're moving the needle because, unfortunately, one of our employees, a woman, just lost her nephew to an overdose, addiction overdose. And she said that the experience that she had with her supervisor, the company, the understanding, the empathy, just the responsiveness was wonderful. Compared to 10 years ago, when she lost a brother, family addiction, lost a brother, and it was like she was all alone. She didn't know who to talk to. She didn't, know how to really engage.
Huge difference in those years.
Huge difference over 10 years if you make it a priority. Second, I would say, particularly with our millennials, we call it just courageous conversations, right? I think the pastor talked about it this morning and the mayor about having the ability just to have an honest conversation. We're all human beings. We share a lot more than anyone realizes at times. But our millennial group is dealing with anxiety and depression due to work pressures, lack of maybe coping skills, wanting to get ahead. So in a small group setting, I mean, we could have an honest conversation about the treatment that they may need, tips that all of us go through in life to help manage that. But at least having the conversation and acknowledging it to your employee group, I think is very powerful. And I could tell you that our 19,000 employees are very proud of what we're doing as an organization, and they want me to continue to do more.
Yeah, I think, as the mayor said, it's seeing ourselves in each other. And we know with this issue, 1 in 4 Americans is directly touched by the opioid crisis. Either they know someone who is overdosed, they themselves are addicted, or they know someone who is addicted and currently struggling. So how do we see ourselves and each other and have an honest conversation about the issue? And for employers, they have to recognize that having an employee who is in treatment and doing well is good for their bottom line. They're more loyal, they stay longer, they are more productive, and their absentee rate is lower than everybody else's. So investing in good treatment for your employees and keeping them employed is the best thing that employers can do.
So Kate, I would just say that we interview the CHROs of the companies that are involved and share best practices. And clearly, this whole idea of openness and the cathartic kind of thing that happens when the senior leaders of companies actually talk about their own personal conditions, my daughter or I personally. And that openness then leads to the opportunity for everybody else in the room. It's a cathartic kind of thing to say, okay, it's all right for me to now tell you my problems. And without that, this utilization rate, as he would describe, is often very low, and with it, there's a whole new attitude that comes forward to it. And I think the other important thing is the training of frontline supervisors on how to ask, are you okay? Because people know when people are really not okay, but they don't know what to do about it. You haven't come to work for the last 5 Fridays. I know you're not sick. What is it about your personal condition? Come on, be open, tell us about your depression. And once that happens, and then you know what to do about it, then you can make a difference.
I just did a story recently about police officers. I don't know if anyone saw it. It's on my Facebook page, but we went to Los Angeles.
Yeah.
And one of the things they do, because the rate of suicide among officers is higher than those who die on the job. So we all talk about police-involved shootings and things like that, but suicide is actually much more of an issue. And they have this program where the partners look out for each other.
Yep.
I mean, it's so obvious, but they're the ones on the front line that see when their partner isn't showing up or isn't attentive or something's happening, and then they can tell. They have a way now, a mechanism to sort of flag a supervisor, and they have mental health support. I want to quickly, Garen, ask you about the depression cost calculator that you have, the One Mind initiative at work.
So much like the calculator that was mentioned earlier, we commissioned Tufts University to do a study on what are the true costs of just depression in the workplace and what are the opportunities to go forward with that. The net of all that is for every dollar that you invest in reducing the rates of depression through all of the programs we said, you get a $3 to $5 return. And if you think about that on the multiple of earnings that companies, shareholders value them, this is like a 10 to 20x return for everything that people do. But we created a calculator that will allow any employer in this room to go on our online, and it's published on the One Mind at Work website, and enter a few set of simple statistics, and you'll quickly be able to see what the bottom line cost of depression is in your workplace. And I can promise you it's a very powerful motivator for corporations to decide, to my earlier point, not only is it the right thing to do, but it's good for business.
Let me put it out to the rest of you. What are some of the best practices that you're seeing? What are some highlights and things that are working that we haven't mentioned yet?
You know, I'll mention one in particular. A couple of weeks ago, we held our Green Cross Gala, which is our safety awards program, and we gave our highest honor, safety and excellence, to Nationwide. Nationwide in Ohio has this great program where when an employee is impaired at work, they're not firing them. They're putting them in treatment. If they volunteer to go, they put them in treatment. They do monthly training of their supervisors and their managers, exactly what you're talking about, recognizing and how to have those kinds of conversations. Yep. And since they started their program in 2015, they've had a 100% success rate with those employees who have stayed in treatment for 2 years. So they're seeing really great results, 100%. And they're sharing their program freely, you know, through an organization in Ohio for any of the employers in the state who are looking to replicate it. That's a powerful program that's making a big difference. And those are the kinds of things we need to see rolled out, not just in Ohio, but across the country.
You know, the best practice that I would like to mention shows how the economics of this all play together. So if we're talking about opioids specifically, medication-assisted treatment is the gold standard. There's a ton of evidence in support of it. It is a best practice. And what we found when we took a look at folks that had an opioid use disorder who received medication-assisted treatment versus those with an opioid use disorder who did not receive medication-assisted treatment, we found very significant differences. So firstly, for the folks that did receive medication-assisted treatment, obviously their pharmacy costs went up by about $900 per patient per year. Their behavioral health costs went up about 150% because they were accessing the services. But overall, on the medical side, we saw $13,000 per patient per year savings because these folks were able to stay out of emergency departments, stay out of medical inpatient days. The first 3 months, their medical costs went up because suddenly they were engaged with the health system. They went and got their scans and their x-rays and went to visit their pain specialists. But at the end of 1 year, we saw $13,000 per patient per year savings. But when I go and meet with our provider community and encourage them to adopt medication-assisted treatment, there is still opposition. There still is this mindset of, I don't believe in this, despite the science. I think we really need to push, and this is something that I work on every day, we really need to push, hey, if we're going to accept that behavioral health conditions are medical conditions, no different from diabetes or high blood pressure, we also have to hold our providers responsible and accountable for following evidence-based practice rather than carrying on doing what they've always done because that's what they like to do rather than this is what you need to be doing.
Christopher, you want to talk about the drug testing program? Am I right on that? Is there a program that you guys have developed?
What I want to talk to
Go
you
ahead.
about is similar. It's just program utilization, but maybe the context. The Hartford's a 210-year-old organization, and one of our operating strategies is to think in terms of we're a startup, and if you think about that, what does that mean? Data and analytics. So I think from a better practice, if not best practice, is in this whole area of addiction and mental health. What is the real data and showing in your employee group? I would say that we're a large organization, so we're self-insured, so we have our own data. We work with our pharmacy benefit manager. We have an employee assistance program. So we're able to triangulate on what is really happening health-wise, emotional and physical with our employees. Last 17 to 18, we noticed EAP utilization was up 30% across the board, 1 year. It's a pretty big jump. Through our employee surveys, through engagement, through dialogue, we determined that we needed to double the amount of days that we granted to our EAP program from 5 to 10. We changed the availability to use an out-of-network provider at in-network cost. Again, to get employees the resources they need to deal with some of the depression and anxiety that they're seeing. So that's just one example. I mean, I could go on particularly.
I think that's really a great example too of preparing or protecting the employee regardless of where they are in this situation, because the employee is not always the one who's addicted or who's battling, who's misusing the drugs. And so having a policy that supports the employee who might be caring for a husband or a wife or a child, but still has the flexibility, the time to be able to be off, who has the kind of coverage that supports them in a meaningful way is so important. And then I think to the point earlier about the stigma, really having an environment that would allow for an employee to come forward and say that they need help or say that one of their family members needs help and they feel supported in that space.
Last example, just data-driven, right? We've reduced over the last 5 years, the use of opioids in our workers' comp claimants by 45%. How? Data and analytics.
Is that, I think I misspoke before. I meant the drug review policy that you guys do. Is that?
A review policy? Yeah.
Yeah.
That's what I would say is that, one, you build a network of responsible prescribing doctors that have good habits and good patterns. Two, we have about 300 clinical nurses that actually review, the prescriptions, for, use, right? What I've learned in this epidemic, the opioid, is that the medicine was developed for end-of-life treatment. It wasn't developed for, necessarily everyday use. So we have clinical nurses that are checking. We have clinical nurses that are, asking doctors and patients and dealing with ultimately, education on, the intended use. And ultimately, we've been able to drive down, as I said, 45% of that use over a 5-year period of time.
Kate, I think it's important we also understand that we really need more evidence-based treatments. I mean, we have, most of our treatments and medications mitigate symptoms, but we're not talking about cures. We know a lot more now about diet, exercise. We know about the use of mindfulness and meditation. These are all things that are now augmenting it, but we have a long way to go in the research agenda for neuroscience in order to get to where we need to go. As a country, we spend about $8 to $10 billion on a problem that costs us $1 trillion. And so it's not, we've got to make this a national priority to really ramp up what we're doing, much like we did with heart disease, much like we did with cancer, and much like what we did with HIV. We don't have that national will yet, and all of us in this room can help get us there.
And is there a place for corporate America to contribute to the research effort? I'm sure there is.
Yes, there is. The whole idea of public-private partnerships is really coming into play, and there are large-scale studies that we at One Mind are doing, and I think you're going to see them getting involved in the game. One of the healthcare providers, in fact, several of them have come to us and said, help us find more evidence-based treatments. What can we do? What research can we support? Because I think no one is in this to do evil. I think obviously there's cost issues, but we just don't have good treatments to really help people come through where they are to where they want to be and lead the kind of productive lives they can.
I'm just going to ask, how are we on time? Sorry, I don't see a time clock, so I have no idea. 5 minutes, okay, thank you. I don't want to monopolize your time today. Can we leave then in the last 5 minutes? Can I have each of you give me the thing that gives you, I'll start with you, Christopher, and we'll go down the line, the most hope sitting here today? What gives you hope?
You could say groups like this. You could say the cultural change. You could say more honest, dialogue, engagement. I mean, you could make it self-serving, or you could make it, this is the right thing to do from a business side. It will help with employee retention. It'll help with productivity. It'll help with attracting talent in a very competitive world. I just see signs of hope, that we're coming together. Deaths are coming down. There's more people getting involved. I think there's less stigma that I could feel, even personally dealing with some family members that have dealt with addiction and mental health issues. It's okay to talk about. It's a fact. It's part of a human condition. Not everything's perfect in life, and you got to battle through it. I think we're more realistic about our expectations.
Yeah, I would just add on to that. I don't think a week goes by where there isn't a national story on this issue. I don't think a day goes by that my team isn't talking to someone about a policy issue or some way that it can be influenced. So I think the national dialogue is key. But what's really encouraging for us, because we have 15,000 member companies who belong to our organization, is that about 70% of them are asking for resources. They're asking for help. So that's promising, because they recognize that there's an issue and they're asking us to help them work through it. And we are.
To me, what fills me with the greatest hope is the reforms that are occurring on the, in terms of reimbursement models. It used to be everything was fee for service. Now we're starting to migrate towards value-based reimbursement. And we see that starting on the medical side, and the medical folks realize that if someone has a co-occurring behavioral health condition, those medical expenses are going to be way, way higher. And because of that, they're starting to pay attention to how to incorporate behavioral health into the physical health component, particularly when they're at risk, when they're held accountable for some of the reimbursement of their health systems. So it's slow going, but that's what I'm most optimistic about.
So I'm an optimist, so I'm hopeful about many things. One of which is my son, Brandon, at 47, who has a very successful lived experience with his schizophrenia. And I see through him and the many people involved in the Stability Network, which is a network of people who are in the workplace doing this passion and this determination that we are not going to allow things to stay the same. We're going to move forward. And I think all of you in this room should be congratulated, the O'Briens and this Kennedy Forum. This is an example of a community coming together, raising the awareness, having the mayor say those kinds of things. We're going to hear from the mayor of New York City talking about Thrive New York City.
First Lady.
First Lady, yes. We're at a point in time where when Brandon got sick in 1990, I think we were like a -2 in terms of awareness. I think today we're up to a 3. So we have a long way to go, but the trajectory is right, and there's many other things that are coming forward, including a big documentary we're doing with Ken Burns that's, I think, going to change the landscape of awareness through PBS that we're starting to move forward with. So I'm optimistic, I'm hopeful, and because 70 is the new 50, you have a long way to go, all right? So there you go.
Well, I appreciate that. Ken Burns' documentary, that'll be, I mean, he hits everything out of the park. When is that going to come out?
We'll have to talk to you about that soon.
Okay.
You're good.
I interviewed Ken
Yeah.
about a year ago for a series that I do called The
Yeah.
Drink, where we have a drink and
Right.
talk about how you got to where you are. He's
Yeah.
fascinating.
Couldn't be, no one better could do
Yeah.
this job, yes.
Well, thank you all for leaving on a high note. And I share your optimism. This room is inspiring to me. My father-in-law took his life 9 years ago, and
Yeah.
the difference that I see between then and now
Yeah.
is, I mean, and that's just 9 years. I feel it. And I feel like I can say what I just said without anyone sort of looking at us strangely anymore. So thank you. Thank you all for being up here. I think I wrap it up from here. Yes? Okay, thank you. I'll be back later. Thank you so much.
Great to meet you, Chris.
Yeah.